State, and they keep dropping. But among children, there appears to be a rise in a rare disease among kids called multisystem inflammatory syndrome, or MIS-C. It's something News 4 I-Team's Melissa Russo was the first to report last year. News 4's Chris Glorioso follows up in Newark with the latest.
For my doctors, thank you so much for protecting me and caring for me while I was sick.
12-year-old Alana Arrington knows she is lucky to be alive and healthy with her mother. Last May, doctors at Hackensack University Medical Center battled to tamp down Alana's immune system. It was suffering a catastrophic overreaction.
Then she ended up having to be intubated, so that was even worse.
Alana is one of about 2,000 children in the U.S. who've been diagnosed with MIS-C, multi-system inflammatory syndrome in children, the extremely rare illness brought on by exposure to coronavirus. There have only been 30 deaths nationwide, but tri-state doctors are seeing an uptick in cases, likely because the onset of MIS-C tends to lag spikes in COVID.
Nationally, they're seeing a spike of cases of multisystem inflammatory syndrome in children.
The good news is doctors are learning to treat MIS-C using blood infusions, steroids, and biologics to reduce inflammation.
So a lot of the anti-inflammatory drugs that are used for things like lupus or anti-inflammatory diseases, autoimmune diseases, we know work in MIS-C.
Despite the therapeutic success, there are still loads of unknowns, including whether kids who come down with MIS-C can flare up again.
Is there any evidence that this will have long-lasting effects for children as they become young adults?
So whether or not children will have long-term effects from MIS-C remains to be seen, since this is a new illness.
There are a lot of unanswered questions, but researchers are making progress. For example, they have determined that most kids with MIS-C have exposure to higher viral loads. And that may be one explanation for why the youngest of children rarely come down with MIS-C, because they tend to have lower viral loads. Reporting from Newark, Chris Glorioso, News 4, New York.